I'm Dr. Andy Kaufman, recovering physician, plandemic whistleblower, natural healing pedagogue, and legal code talker. You can call me the Truth Doctor. I'm here to shift your paradigm as I perform a radical forensic dissection, discerning fact from fiction, science from pseudoscience, medicine from poison, law from legal fiction, and individualism from collectivism. This is your channel for unraveling the truth about health and science. This is the Healthy Living Livestream. Hello, everyone. I am Dr. Andrew Kaufman, here for another Healthy Living live stream. And this week, we are going to open it up to answer all your questions regarding health science and any other topics you deem appropriate. I do have a list of questions which were submitted in advance, as well as questions from all of you live at this time. So why don't I begin with answering a few of the questions submitted in advance. Iku asks, does the Alchemical Detox Course cover all the material in the 3 terrain workshops on the liver, heavy metals, and water? Or are the terrain workshops better for focusing specifically on these issues? Well, the Alchemical Detox Course is a comprehensive course that covers all of the material in the workshops, but also allows you, through the knowledge and skills that you learn in the course, to actually create your own custom protocols. So if you want to have that sophisticated level of knowledge, that is definitely the right way to go. If you're focusing on a specific problem and just want to get the information about how you can address that effectively using natural methods, then the terrain workshops may be the choice for you. Okay, we have a question from Janish. What would be the best way to heal Epstein-Barr mononucleosis in a 19-year-old boy? Thank you. So there is no Epstein-Barr virus, and you can look into my previous work if you want to discover some details about that. So we have mononucleosis, and that is a condition with no real validated diagnostic test, but essentially what it amounts to, usually speaking, is a chronic sore throat, swollen glands, and perhaps some decrease in energy. So I would look at the specific factors that may have brought about that condition in the boy, and really the age is not important in how you would approach this necessarily, but you would find out what types of toxic things that he may be exposed to. A lot of teenagers eat a lot of junk food, so that could be the source. So there could be many other things from the pharmaceutical industry, occupational exposures, et cetera, and also look at the nutritional status. And then based on what seems to be the most likely underlying cause, there would be a way to help your body address that. All right, one more question from Jacob, and then we'll take some live questions. What are your thoughts on German New Medicine? So I think German New Medicine is quite interesting, and it raises the very salient point that psychological conflicts, traumas, and other issues are often expressed physically as what we might refer to as disease, or it may have a significant contributing factor to a health condition that might have a primary physical cause. So I think it is important to address these aspects. Unfortunately, the specifics of German New Medicine, like, for example, how they talk about different developmental lineages of tissues and organs, like endoderm, ectoderm, and mesoderm, being involved with certain types of psychological conflicts and having the ring findings on CT imaging and all of this, as well as the fact that there's really no clear intervention based on German new medicine paradigm, which does a very good and detailed job of finding the cause of the problem, but then doesn't have a clear mechanism of how to address that problem. So all these aspects of German new medicine have not been validated in any scientific research studies, unfortunately. And there have been some attempts to look at various aspects, and people were unable to confirm some of the underlying hypotheses. So I wouldn't go into too much detail with it, but take away that concept that psychological issues are an important part of any healing situation. All right, why don't we take some questions from our live audience today. So Irene McPhee asks, wondering how your freedom from mortgages, etc., is progressing. Yes, outside of my medical research and knowledge, I have also engaged in some experimental litigation since I've learned a lot about the law, and it seems that mortgages are carried out with inherent fraud in the transaction. And then in addition to that, there are many other frauds that are commonly perpetrated by various parties in the financial system. And this is what I am investigating. And in fact, after this session today, I will be working on a motion in one of those cases. So I will let you know when there are any significant results. All right, Tom Keegan asks, would eating gelatinous jiggly stuff from a refrigerated whole chicken help for collagen for someone who is hurt from ciprofloxacin or quinolone family drug poisoning? Yes, so this is a very important point. There are antibiotics which are commonly used for a variety of conditions, especially urinary tract infections, and these are called the fluoroquinolone antibiotics, and they include things like Cipro and Levaquin and several others. And in addition to other toxicities, which I won't mention, there is this issue that it can cause tendon rupture of important tendons in our body, which attach muscles to bone. And this can cause significant physical disability and is very worrisome. So I think there are two components. One is that something, either the drug or a metabolite of the drug, is directly toxic to tendinous tissue. And that, of course, is a type of tissue that has a lot of collagen for the structural elements. So one issue would be to help your body cleanse the drug or drug metabolite out of those tissues. And then the second part would be to supply the right building materials for your body to repair that tendon. And that would definitely involve eating a lot of collagen, and that jiggly stuff on the chicken, that is exactly what it is. And you can make a broth from whole chickens, chicken feet, and chicken bones that will contain a lot of that jiggly stuff. And I would recommend eating 1 cup of a gelatinous broth on a daily basis, or the equivalent, in order to promote your body's healing. Now, it may also be important to do some types of physical rehabilitation. And there are certainly a lot of experts on that area out and about that you can find. All right, next question from Sandra Earl. I have a watchman in my heart. Since you don't know what it is, I'm wondering. No, I have not researched it and still don't know what it is that you are referring to. And I don't recall being asked this before, but that doesn't mean that I wasn't. Why don't I, after Izaro's question, take a couple more of the pre-submitted questions. So having food poisoning, stomachache, and vomiting the offending food, why then does it often result in a sore throat and stuffy sinus? Well, that is a pretty straightforward question to answer. And I think it's simply because of the vomiting. So you got some poisonous substance in your gut, right? And your gut reacted violently to rid your body of that substance before it got absorbed internally. But when you vomit and things go in the reverse direction from eating and drinking, then that toxic material, along with gastric juices, which have a very acidic pH and can cause some corrosive damage to other tissues outside of the stomach. The stomach has a special lining that allows hydrochloric acid essentially to be there without damaging the tissue. But when all of that material comes up through the esophagus and the throat and mouth and perhaps into the nasal passages as well, because they are connected in the throat, that some of the acid and the toxic material is exposed to those tissues, causing irritation. And that's why you would experience those protracted symptoms, but they should resolve relatively quickly. Okay, back to some of the questions submitted in advance. Tris asks, how do you get rid of cysts on your tonsils? Well, I'm not sure if you're talking about cysts or crypts. And these are things that kind of develop chronically. And I haven't had experience with this directly, but I would say that the rules are similar of how I would approach any health problem. I would try to find out what is the cause. So this condition, in my experience, usually occurs when in childhood people have recurrent, throat infections, if you will, but acute episodes of pharyngitis that eventually they can have cysts and crypts develop. So you have to look back and say, well, what was it that caused that in the first place? Am I still putting those things in my body? Have I done any kind of cleansing to help my body get rid of those? And there are things you can do locally that you can gargle with, for example, like doing oil pulling with something as simple as coconut oil, where you can bathe the cysts and help the toxins that are stored there get out of your body completely. I think it probably would take some concerted effort over a period of a few months to completely get rid of them if this approach were successful. All right, one more pre-submitted question from Gloria. Can you really get sick from canned food? And she wrote botulism. So I think this is an important concept to consider here. And canned food, by the way, may have other hazards besides food poisoning, right? Which botulism would be a form of food poisoning. And that is that if the cans are often lined with plastic, so plasticizing chemicals can leach into the food. And also cans may be made of metals like aluminum, which could cause aluminum to leach into the food. So I'm not saying never eat canned food. I have a store of canned food just in case of any kind of crisis where I need an emergency food supply, but I don't eat it on a regular basis. Now, with respect to food poisoning like botulism, I think we'd have to consider the concept that if one organism ingests the waste products from another organism, this can be harmful to your health, right? Because there's a reason why it's a waste product. Now, there are, of course, some exceptions in nature, like dung beetles, right? Who can, and microorganisms can eat the waste products of higher organisms. But when we have variety of microorganisms grow on different things, sometimes their excretions are toxic to other organisms. And this would include the botulinum toxin, which has been exploited for cosmetic purposes, but essentially it could cause paralysis. So you don't want to eat food that is spoiled in general. And there are other types of organisms that can grow on spoiled food and also secrete toxins that you can get sick from. And the most well-known is probably Staphylococcus or staph toxin. And this is what you might experience if you leave some potato salad out for too long and then eat it after it's spoiled. So those are the considerations with respect to botulism and food poisoning. All right. So back to the live audience. Brian C. asks, can you please explain full faith and credit and whether it's a valuable concept to know? So this usually applies to obligations of the United States or debt of the United States. So you can look at USC 8, Title 18, Section 8 to see what are obligations of the United States. But this essentially speaks to the creditworthiness of the party that you're describing as putting its full faith and credit in that party. So really, it's not a complicated term, although a party can always default, and even the United States government can default on debt. All right, Clive Masterton asks, what is the true cause and remedy for nail fungus? Well, there probably are more than one cause, but in general, this is a long-term buildup of some kind of toxin that probably, it affects the small blood vessels and the tissues that are, have the lowest circulation. So for some reason, the toxins that go through the blood might get deposited in some of these tissues that are what we call distal, like they're the furthest away from the heart, for example, that get the poorest circulation, and perhaps there's not enough blood to flush those things out, and they accumulate there over time. And then various organisms start to grow to mediate the situation and clean up the damaged tissue and try to clear the toxins, but they're unable to affect complete healing because usually we're putting more of these into our body on a continuing basis. And so we get this kind of chronic, toenail fungus. We can find yeast and fungus there, but they are not actually the cause of the problem. Rather, they are the result. Now, this condition is often associated with other situations that affect the microcirculation or the small blood vessels, like diabetes, for example. So people with diabetes much more likely to have this issue. So you have to address the underlying metabolic problem of the whole body for overall health. And then there are things you can do also locally at the same time you're doing a whole body type of program, which can help the condition resolve. Now, when you are successful, just know that it takes sometimes 6 to 12 months for the toenails to completely grow out and look normal again. So you can be patient, you can cut off the damaged area, and then you can see the line where the new toenail is growing, and it will be clear, and that will be your indication of a good result. So if you want to look into the Power of Pine protocol, that is one that has a good track record of helping people resolve this particular issue. All right, Alexander. Now, this is a pre-written question. Okay. I was curious to know your take on blood flow restriction therapy, commonly known as BFR. I really don't know anything about that, but let me bring up something that is related and quite interesting. And of course, I cannot remember the name of the veterinarian who did these experiments, but you can certainly find it out there on the internet if you search some of the terms that I'm describing. So there was this problem in medicine that when we have someone who bleeds out there in the world somewhere, that, we think that in order to save them, right, if they have major bleeding, that we need to get them a blood transfusion, but that's only available in the hospital. And even a given hospital may not have every variety of blood available for a transfusion at any given time. But it would be much better if you could do something like when the ambulance arrives, like in the field, because you'd have a lot more people surviving substantial bleeding. Now, interestingly, when I was in North Carolina at Duke in my psychiatry residency, they actually had a big experiment that they were doing, and they had to advertise all over the city because you had to opt out if you didn't want to give consent. And they were giving some kind of synthetic blood product that was supposed to be able to save you if you had massive bleeding or hemorrhaging. And I thought this was, kind of a strange solution, but at the time, thinking man-made technology is superior, it made sense. Now, many years later, I found out that there was a veterinarian who, many decades ago, did some very interesting experiments with dogs. And what he did was he bled dogs out so that almost all of their vascular volume was gone, and they would have definitely died. But instead of giving them a blood transfusion, what he did was he got seawater, filtered it, and diluted it to the concentration of our body salt, and essentially normal saline. So he made an isotonic solution of seawater and infused that into the dogs after bleeding them out. Now, this is the amazing part. All of the dogs survived, but after the experiment, the dogs actually healed many of their health conditions that they had been suffering from. So this was quite an amazing finding, and there has been subsequent research, and there are even products that you can buy that contain this type of water, but perhaps not easily in volumes that you might use for an emergency transfusion. So I suggest that you look further into that subject, as it is quite fascinating. What causes dandruff, Kevin L. asks? Well, I think dandruff is generally associated with a broader skin condition called seborrheic dermatitis. And you can get the flakiness that you might get in your hair also on other parts of the body. It tends to occur in the midline, in the center of the chest, sometimes in the forehead, the chin, in the nasolabial folds. And I think this is most likely due to liver congestion. If you look at my recent live stream on the liver skin connection, you can learn more about what I am referring to, and also probably a lot of dietary factors, especially sugar and processed carbs, are most likely involved. So if you adopt a very low carb or zero carb diet, along with some liver cleansing, many people have reported excellent resolution and reduction of the flaking. All right. Riche asks, my 26-year-old son will be released from a court-ordered psych ward lasting 3 months. He's been force medicated with a long-acting antipsychotic injection. Do you have any recommendations for detoxifying his body from this experience? Well, yes, of course. And let me say a couple of things. One is, depending on how many injections he's received and whether he's still taking oral medications, the injections are very long acting, so they kind of can taper themselves. But if in general someone is taking antipsychotic medications, even if they don't have a serious mental illness, if they've been taking them for more than a week or two and then suddenly stop taking them, that can actually cause psychotic symptoms, even in someone that never had psychosis before. And this phenomenon is known as rebound psychosis, and it's well documented. And I've actually seen it in people who had psychotic issues and people who didn't have psychotic issues. So definitely be careful about that. I think some liver cleansing would definitely be required for many of these antipsychotic drugs. They have a lot of heavy liver toxicity and metabolism, and a general cleansing protocol, which can also help substantially with some of whatever the psychological issues are that led to that hospital situation. So there are definitely things that you can do. All right, Thomas Monroe, great to see you here, Thomas. Is there a remedy for an abscess tooth other than extraction? Well, yes, there's always a remedy, but I would say in this situation, it kind of depends on how far gone the tooth is. And by the way, a dental abscess does not always result in extraction, even if you go to the dentist. The first thing would be to try and drain the abscess, because if it can drain, then that stuff can get out of your body. So that if it's not able to drain on its own, then that's something that may have to be considered, is cutting it open so that it can drain. Now, there are other ways, of course, that you can address it. One of the things I'd recommend is to do a water fast right away, because that's been shown to help speed up healing of these types of issues. The decision about what additional dental procedure to carry out, whether, you know, that could be a root canal, it could be an extraction, or just an incision of the abscess, it depends on the condition of the tooth. So you have to have a way of sort of knowing how bad the tooth is. Certainly you could go to a dentist to find that out. And you can always, you know, you make the decision about what the dentist does. So even if they're going to look at it, you can say, I don't want an extraction, so that they won't do that. Now, they may tell you that the tooth is, you know, way gone and can never recover. In that case, you may want to go ahead and get the extraction, but it's helpful to just have a little bit more information. Let me also just put out a warning that dental infections, if they are not addressed quickly, they can spread and cause very, very serious problems. Like they can spread even into the brain. They can spread into the throat and cause problems with the airway. So you want to, you know, take swift action. I'd recommend water fasting immediately, and then assessing things to figure out what approach you want to take, whether you want to go to a dentist, you want to try natural remedies at home first, but do not delay addressing this. Don't ignore it and just let it get worse, because it can result in very severe complications. Overall, it's important that we address our oral hygiene, you know, over time, and not just let it go, because if we let it go, at some point, these problems are going to pop up. And the biggest factor in oral hygiene is your diet. And it's really sugars and simple carbs that result in a lot of the decay. All right, we are cruising along. So Solo Cat 1980 asks, what can be done for someone that is debilitated from a fluoride antibiotic like levofloxacin? So I think that's really the same question we had before about the tendon rupture issue that I spoke about. So I would suggest you go back to that part of the show and get all that information. All right, Eric Olson asks, best strategy to detox microplastics, BPA, and phthalates from your body. Well, microplastics is interesting, and I have certainly talked about that at length. It is not 100% clear what the consequences of the microplastics themselves, but microplastics often absorb many other compounds, including heavy metals, and can leach those out and cause toxicity that way as well. BPA is a bisphenol, and phthalates are a common plasticizing chemical. Now, phthalates are water soluble. So if you simply eliminate your exposure to them for a period of, I would say, 3 to 5 days, they should come out of your body. Other plasticizing compounds, and probably microplastics themselves, are not water soluble. They're fat soluble. So you have to do some kind of procedure that allows your body to get rid of fat soluble toxins. Now, simply going on a high fat diet or on a fasting can actually help your body do this. And then also using healing solvents, like, for example, in Ayurvedic medicine, they actually have preparations based on ghee or clarified butter that help with this type of detox. And in the Power of Pine protocol, there is a different type of healing solvent, but those would be the way to get rid of those fat soluble toxins separate from phthalates. All right, we have a question from Peter M. You need to publish a natural remedy health book, Andy. Well, that's not exactly a question. And, it's certainly something that I have planned for someday. All right, JM asks, hello, Dr. Kaufman. What would you recommend if a loved one had a brain hemorrhage? They are currently tube feeding and feel like throwing up when eating food like yogurt. Wow. Well, I think it largely depends on the cause of the brain hemorrhage and, what their current condition is. I don't know why you would want to necessarily eat yogurt in that situation. And so if this is from an injury that caused a hemorrhage, then there would be different aspects of the best thing to do than if it was, say, like a ruptured aneurysm, or if this is from something different, like a brain tumor. So it kind of depends on what the specific situation. But in general, of course, you would think of, once again, water fasting, because that helps speed up wound healing. So maybe stop the tube feeding, don't eat anything. If you put food or smell food and feel nauseated, then that's a sign that your body doesn't want to eat. And this, may be difficult to negotiate in the hospital because they might think that is foolhardy or harmful. But we can actually fast easily and safely for at least 21 days and likely much longer than that. But there have been well done clinical trials up to 21 days in cancer patients receiving chemo, and they had no complications. So this would be one of the major things. Now, if it was something like a ruptured aneurysm, then that tells you there is a structural weakness in the tissues and blood vessels in the body. And unless there's a specific reason why there would be such a deficit, like from a prior severe head injury or brain surgery or something like that, then replenishing collagen-rich foods in the diet would definitely be an important aspect. So I hope that was a helpful response. Sometimes these very complicated and serious medical situations are kind of hard to figure out unless I have a lot more information. Okay, Cecilia D. Raphael. Andrew, are there any risks by 7 days or longer fasting? Well, everything has a risk, but the risk is very minimal from fasting of any problem, unless you are starting your fast in a malnourished state to begin with. And the other thing is that you need to make sure that while you're fasting that you drink adequate water. And I do have more specific information on that in my Way of Water workshop. And there are other sources of information about how, the drinking requirements during fasting. And then also you want to rest. So you shouldn't be doing water fast while you have a full schedule of work. You shouldn't be exercising or playing sports or doing anything that would make you sweat while you're fasting. You need to rest and let your body heal as optimally as possible. But it is extremely safe to do this. In fact, you might even reason that or conclude that our bodies are designed to go without food for periods of time because we have lots of physiological mechanisms to accomplish that. And if we were living a hunter-gatherer lifestyle, like many believe that we have in the past, then of course there would be times when no food was available for a period of days to weeks. All right, we are getting near the end, but let's take 2 or 3 more questions. So Alex No Name asks, what's the difference between distilled water and purified water? Which one is better for health? Would you recommend machines for distilling tap water at home better than buying at the store? Well, so distilled water is just a type of purified water, right? Because distillation is one method of purification of the water, and it's a very good one because the resulting water is extremely pure, and you can even redistill it if you want to further increase the purity. So if you're doing laboratory type work where you need absolutely pure water, this is one of the gold standards. Now, other methods of purifying water may be adequate as well, but some are not adequate. So just running your tap water, for example, through an activated carbon or charcoal filter will remove a lot of things, but not everything, and not some of the most important things like some of the heavy metals or fluoride. Reverse osmosis is the other technology, which I feel is adequate for purifying tap water and making it safe to drink. The tabletop distiller that I use and have used is the Mega Home distiller, which is a stainless steel unit with a glass carafe that is, I believe, 1 gallon. So that would be, a trustworthy device, but I'm sure there are others out there as well. I would generally not recommend buying distilled or RO water at the store unless it is available in glass bottles, which some of you may find. But if you're carrying huge glass bottles with, 10 gallons of water or 5 gallons of water, that can be quite inconvenient. So I think it's better to probably make your own at home. Okay, Truth Seeker. How do you recommend treating a cavity? Well, I would say just an uncomplicated cavity would be quite simple to treat. And I would also, just in general, for dental issues, refer you to the book The Dental Diet by Stephen Lin, because you can learn quite a lot of information from his writing. So if you have a simple, uncomplicated cavity or dental carie, there are essentially 2 things that you can do to help that tooth repair itself. One is diet. So you need to eliminate any sugars and simple carbohydrates from your diet while you're healing that cavity. And secondly, you simply pay extra attention to that tooth when you're brushing. Now, you don't need actually toothpaste or any kind of medium to do this. You can, of course, use something like Ipsab powder or activated charcoal. There are very few, but some available toothpastes that do not have dangerous ingredients, and you can find these on the Environmental Working Group's Healthy Living app, which is an excellent source of information. But really, it's the mechanical action of the brushing that is going to help the tooth heal. Now, if you want to augment this, you can also do something like oil pulling to help clean out that tooth. So you combine those 2 procedures and have a little patience, and your body should be able to reverse that cavity. All right, last question for today from WC. I'm struggling with prostatitis that happened overnight, using homeopathy for 2 weeks, but minimal relief. Any suggested protocols? I'm thinking of switch to TCM if no major changes occur in 2 more weeks. Not sure if I know what TCM is, at least by the initials. So I'm wondering, WC, is this acute prostatitis, like an infection, or is this like BPH where you have some issues urinating? So I'm going to assume that this is acute prostatitis, and this, can happen for a variety of reasons, and sometimes we don't know what's going on, where we have an inflammation, of the prostate gland, which can be, of course, very uncomfortable, painful with urination and just in general. So as with traditional Chinese medicine, well, I'm not really familiar with what interventions Chinese medicine would have to offer. Of course, Western medicine would recommend antibiotics. This has been going on for 2 weeks. That is quite a conundrum. So once again, for an acute situation like this, I'd recommend water fasting. And you also, because this involves the urinary system, you would want to increase your water intake so that you have excess urination for a temporary period of time, and that will help flush out whatever is causing the irritation of the prostate. So I would still stick with, I would probably go with 16 ounces every 30 minutes. Try to drink, 4 to 5 liters a day for an average 70 kilogram adult man, something like that. If you're not noticing that you're using the bathroom more often, then you're not drinking enough. Now, this, of course, may bring some additional discomfort, but it will be temporary. And then the other aspect is to consider using some healing solvents like castor oil, which you can mix with other solvents like essential oils, the pine solvent, or possibly even DMSO. And you can apply this to the perineum, which is colloquially known as the taint. It's the area between the scrotum and the anus, because the prostate is right on the other side of that tissue there. And most of the solvents I mentioned will penetrate readily through the skin and help dissolve the toxins that are in the prostate causing the condition. So I think that combination of approaches, you should get relief. I think pretty quickly, within a couple of days, you should notice a decrease in the symptoms and stick with it. It shouldn't take that long to resolve an acute situation like this. Well, let me thank everyone for the interesting and stimulating questions. I enjoyed answering all of those, and perhaps I will put all of these thoughts in a book on natural healing sometime soon that you all can take advantage of. Please don't forget to check out my shop with some excellent products that could be part of your natural healing experience. And I look forward to seeing everyone next week for another Healthy Living